Hello everyone, my name is Jennifer. I am from Germany. And I'm excited to talk to you guys today about my upcoming surgery. Under eye fat repositioning. In my case, actually, we are going to take reposition fat that is already around the area of my eye and just reposition it, yeah, like to the lower part where the dark circles are. So pretty much we want to make this area more like plump and filled up so that hopefully afterwards I will not have dark circles anymore. People always ask me like, oh, are you tired? I hear that all the time. And it makes me very self-conscious. So that's the first procedure I'm going to do. And yeah, well, hopefully I will look more awake. That's it. I don't want to look tired anymore. So the second procedure, I will get a breast augmentation. I was always on the skinnier side, and this is actually the procedure that I was desiring for a very, very long time. I'm about like an A cup. I always thought, okay, if I ever get a chance, if I ever can do it, I would like to get my boobs done to feel like a woman. My desired outcome would be to have just a bit of something to show and a bit more like feminine shape to it. So I'm super excited for that. I've done my research, I know what I want, and I'm sure about this. And I watched a lot of vlogs or videos online of other girls that share the experience like I do with you guys right now. I think that is so helpful. It really gave me a great perspective on what to expect. I'm getting my pre-examination, doing some blood tests and x-ray to make sure I'm ready to go for surgery.
What do you feel right now?
I'm excited for it because I've been waiting for it for so long, like half my life. I'm also nervous. I never had plastic surgery before. This is my first time, so of course I'm nervous, but not too much. See you on the surgery day. I'm so excited because today is surgery day. I'm pretty much on my way to get surgery. And obviously I hope everything's going well. And today I have my consultation with the doctor before surgery. Yeah, I want to ask some questions like, yeah, how long will the surgery take? Obviously, like possible complications. How will the anesthesia be? I'm quite nervous.
What is your expectation after the surgery?
Well, after surgery, obviously for the breast implants, I'm hoping for volume in the upper area to have a more feminine body shape. And when it comes to the fat transfer in my face, I hope that, yeah, I will look more fresh and bright and just a little bit more plump and maybe also a little bit younger again.
How is the plastic surgery in Korea and why you choose to have the surgery in Korea?
I think worldwide, Korea is quite famous for having great plastic surgeries, and yeah, they know what they're doing. So I'm in good hands. I trust that I'm working with the best here. So let's go to the consultation.
Okay, so we decided to go with the inframammary fold, and we're using a Mentor Extra implant, $295. I'm going to do some design. I might change some of my thoughts. I might go straight for I just want to do the measurements again. So Jennifer, if you don't mind standing here for me for a second and then open up your gown and hold it for me. So you do already have good breast tissue to work with. So I'm not worried about you having an unnatural breast, but you do have what's called a pectus carinatum. It's where your chest wall protrudes. That's something that I can't control, right? So if you have a flat surface, the implant will go like this. If you have protrusion, it will go more lateral. That's why later on we're using sports bra to get more cleavage, but it's just the shape of the chest wall that you have. But with 4 or 5 years, what happens is the implant compresses down on the chest wall and it becomes more flattened and it becomes more natural and you get more cleavage. So it takes some time. So I think we do have good volume. So the reason that I chose a 295cc implant is that we want to keep the base diameter and we want to keep the breast implant within the base diameter. So this is probably going to be about a full B2C. Is that something that you're looking for? Do you want to go a bit larger?
I think we decided on 320.
320, okay. We'll change it to 320, right?
I mean, if you think that it's
I think it's good, yeah. I think 320 is actually, this is what I wanted to tell you. Although I wrote down 295, that was nipple sensation, the average size that I would put without nipple sensation being compromised. But I would like to use a bit of a larger implant, 320. It's about maybe 3 millimeters difference in diameter. If I go larger with such a fragile, very thin skin, what's going to happen is it might, rippling might be an issue, so I don't want to do that. So within 320, I think everything is going to be good. All right. Any other questions before? So you can wear your gown. Any other questions before surgery?
We're going to talk about fat grafts on your face and also the lower eyelid area. Basically, first I'll start with the lower eyelid, this area. Basically what we do is reposition the fat, and that means that the protruding area over here, we call this the fat bag, because it's like a bag. Mm-hmm. We try to reposition that fat into the depressed groove area here. So in that way, the protrusion goes away and also the depression goes away. So this area would be more kind of flat rather than depressed over here. So that's what we call something called transconjunctival, because we make an incision inside conjunctiva. So transconjunctival fat reposition. And for the fat grafts, are there any specific areas that you're concerned that
on
you
the
want?
face?
Yeah.
Well, it's possible in the cheeks, right? Then these ones and lip area.
You mean like here? Oh, I wouldn't really recommend this area because this area we make expressions, we make faces, so they tend to migrate over time. So that's not a common area for fat grafting. So in my opinion, the anterior cheek here and here, it'll look good if it adds more volume, and also the nasolabial fold area here. Especially like these areas, if we add more volume, it'll help with the fold.
Is it possible for the here as well?
Yeah. One thing I'm concerned is you weigh too less.
Yes.
It's too less. So I don't know if
it doesn't have to,
because normally for the forehead we usually need at least 20 cc. But I'll try my best.
Where are you going to take the fat?
Usually we do the thigh, or maybe if that's not enough, maybe the butt area.
It's not.
Oh, so if you prefer not to. So
I like my bum.
Okay. Maybe you'll try the inner thigh and also the outer thigh, both sides. We'll have to prioritize the areas because if we don't have enough fat, maybe we'll have to skip the forehead area.
Yeah.
I'm going to start designing. And for first off, we're going to start designing the fat reposition surgery on the lower eyelid area. So we can notice the fat bag, fat protruding over here and over here, which I'm going to mark right now. And also by this surgery, we will try to resolve this groove area over here, which is called the tear trough deformity. So basically, we'll reposition these fat areas into this area. Now I'm marking where the most depressed areas are on both sides. So basically that is our design for the transconjunctival fat repositioning surgery. Now I'll start designing for the fat graft. I would want to focus on the anterior cheek area first. These markings are where I'm going to put the most amount of fat into, because we want the cheek to go up, add more volume, which will add more youthfulness. And also over here, the depression over here causes the nasolabial fold more noticeable. So we'll add more volume here and a little bit also in this area. So Jennifer doesn't have much fat, but we'll try our best to harvest as much as we can so we could add more volume to the anterior cheek and the nasolabial fold. And maybe if we have enough, maybe we'll go to forehead area also. I think if we have enough fat, we'll try the temple area also. Okay, good.
So for the breast surgery, we decided to go with 320cc instead of the original recommendation of the doctor. Actually, that was 295cc. I wanted to go a little bit bigger, and the doctor said that would be fine. Anything over 320 would be a bit too difficult to do in my case because of my frame and not enough tissue, and then maybe later on there will be difficulties with rippling of the implants. We agreed on 320cc. The doctor is very nice. He has a lot of knowledge and he knows how to calm me down, and he explained everything very well.
You look too nervous.
I am.
What do you want to do after fully recovered?
I mean, for the breast surgery, I'm hoping to fill out my tops more and have I can wear more various tops that show a little bit of cleavage that I couldn't wear before. And with the fat repositioning, as I work in the entertainment industry and I'm often in front of the camera, my issue was mainly just looking tired in front of the camera, and hopefully I will look brighter and more refreshed. Okay, now surgery time. Bye bye.
I'm very nervous.